I'm pleased to welcome you to the Societal Impact of Pain, the so-called SIP Symposium 2012 here in Copenhagen during the Danish presidency in EU. As you have seen in the program and also in the Congress materials, this third SIP Symposium is again kindly funded and logistically supported by the pharmaceutical company Grünenthal, and it is hosted this year by the Danish Association of Pain Patients, FAKS. I would like to thank already now and here these two collaborating organizations for their great support. So let me just see whether it works. Can I move to the next slide, please? Is that possible to see the second slide? No? You don't see any slide. That was the first one out of a row of 6 slides, but even without slides, it's not a problem. You know, anesthesiologists always solve the problems, and they do that very fast. So, as you see, maybe now, EFIC is a multidisciplinary European federation of meanwhile 36 national pain societies across Europe, representing more than 20,000 members, 20,000 physicians, scientists, nurses, psychologists, pain therapists of any specialty. So they represent not only their countries, they represent pain medicine as such. And what we all have in common is our active involvement in pain medicine. And we all share the 3 major goals of EFIC: to develop pain medicine, to improve the availability of best practice pain treatment all over Europe, and to attract public attention to pain and to chronic pain patients. As you of course know, the acronym SIP stands for Societal Impact of Pain, and EFIC has years ago realized that we must increase the awareness about the tremendous and notoriously underestimated societal impact of chronic pain. We must increase the awareness among other healthcare professionals, but even more in the public, among politicians, among the decision makers in our healthcare systems. So there should come the third slide, and I try my best to do that. In 2001, EFIC has therefore published the so-called Declaration on Pain in the European Parliament, and with the valuable support of Grünenthal, EFIC has also organized already 2 previous SIP symposia in 2010 and in 2011 in Brussels. These past 2 SIP symposia were important first steps towards the public recognition of chronic pain as a true challenge, not only to our patients, not only to their physicians, but a true challenge to the healthcare systems and to the societies across Europe. During this second SIP symposium in 2011 in the European Parliament in Brussels, the roadmap for action with its 7 strategic goals for improvement of pain care has been launched. This year's SIP Symposium is the third symposium in a row, and more than 160 organizations have already endorsed this SIP Symposium, including also the high patronage of the Italian Presidency of the Council of Ministers and the Italian Ministry of Health. Among these topics that we will discuss during the next days, 2 days, let me just highlight Workshop 1 that is going to take place here in this hall immediately after the opening, which will focus on EFIC's position on pain as a disease in its own right. And I think the future position of chronic pain among the disease categories of the International Classification of Diseases, the ICD, which is published by WHO, will also be discussed. It's an important point during this workshop 1 here, because a revised version of the ICD, that will be the ICD-11 then, is already in the pipeline of WHO, and we would very much appreciate to find chronic pain as a disease category in this revision of ICD. Workshop 2 will focus on the influence of pain for an active and healthy aging based on the EU Commission program on the European Innovation Partnership on Active and Healthy Aging, so another important topic. Other workshops will deal with pain commissioning and best practice cooperation models, with education and research programs, with experiences from establishing national multi-stakeholder platforms, and finally also with the future pain management scenarios in the European Union. High-level keynote speakers will pick up these topics in the plenary sessions on the second day, tomorrow. So that is what this SIP 2012 is all about. I'm sure this third SIP Symposium will again develop to a pan-European platform for those who bear responsibility, those who are involved in health care and in health policy. Adequate pain management is not only an ethical duty for all caregivers, it must also be considered a basic human right. But without a strong political support, high-quality pain management and high-quality pain medicine will not reach those who have the most urgent need. Providing the economic and political conditions for widespread and comprehensive coverage is a political task, and I'm sure that this SIP Symposium 2012 in Copenhagen during Denmark's presidency of the Council of the European Community will be a further step towards this public recognition of chronic pain, towards the acceptance of the tremendous challenge all our society are facing, and it will also be a further step towards reaching the important goals of the roadmap for action. Important for our patients, first of all, but also for the future development of pain medicine and for the future development of our European healthcare systems and finally of our societies. So thank you again for coming. Thank you for the active contributions, and also welcome again to Copenhagen to the third SIP Symposium. And now I may ask Mrs. Pia Frederiksen, the president of the Danish Association of Pain Patients, FAKS, to come up to the podium and to give her welcome. Pia, please, the podium is yours.
Thank you very much. Thank you very much for joining us here in Copenhagen. Dear all, a very warm welcome to the Societal Impact of Pain 2012 here in Copenhagen. I'm so proud to stand here today, and I'm proud that so many of you pain patients, in spite of all your pain, have chosen to participate in this conference. I'm proud and overwhelmed that so many decision makers and practitioners of different professions, together with us patients, want to use this opportunity to create a platform to put the pain issue on the public as well as the political agenda. We have to make a difference, and that's why we are gathered here today in Copenhagen. More than 400 people from over 30 European countries are gathered here today. We have managed to assemble doctors, patients, representatives from healthcare institutions and governmental bodies. I hope that together we will get a couple of exciting days and very inspiring days. We all know that chronic pain is a very low priority area. Patients spend years trying to get the right help. Yes, even here in Denmark. I clearly remember the first meeting I went to in Pain Alliance Europe, where I spoke with many of the other union presidents. There was a consensus that Denmark was the perfect place to live in and that we have a perfect healthcare system. But even here, in small, safe Denmark, pain patients are not treated with dignity. And that came as a big surprise. However, I will specify that if you are suffering from anything deadly here in Denmark, it's a great place to live in. But if you just have chronic pain problems, we are faced with exactly the same problems as the rest of Europe. When you consider that 1 in 5 Europeans suffer from chronic pain, it is noteworthy that it's not an area that is being taken more seriously. I think there is some kind of fear from the politicians. This is due to the complexity of pain treatment and the need for interdisciplinary interventions. This is a big problem that affects so many people that it's confusing to do something about it. It's easier to take care of the small patient groups, where you can quickly make an impact assessment. What will it cost to do something about this group, and what can we save in the end? I do hope that the next few days will help to highlight that chronic pain is a disease on its own right. It is of great importance that we all will help to highlight the problems in connection with chronic pain. We will help to develop concrete solutions to what can be done better. And unfortunately, there is a lot that can be done better. We will exchange experiences. We will tell what is good and what is bad in pain treatment in our own countries. And we all know that time is an important issue. Everyone knows that the untreated pain gets worse over time, so quick involvement of relevant professionals is essential for pain patients' future. Patients with pain cost society a lot of money. Due to a growing elderly population, the number of pain patients will increase, and we need money to help them all. There must be found new pathways for care for patients. If given the right tools in time society will save money and the patient will have a far greater quality of life. We must find ways to retain pain patients in work. The longer you're outside the labour market, the more difficult it is to come back, and the more risk there is that you end up on benefits, sick leaves, or early retirement. There must be education, training of doctors, nurses, psychologists, physiotherapists, and even us patients. We must learn to live with our pain, and society and our relatives must learn to live with us. Interdisciplinarity is a necessity. Patients should early be examined from a holistic perspective, both physically, mentally, and socially. We have to realize that not two pain patients are alike. We must ensure an interdisciplinary, individual, and qualitative treatment of each patient. However, I am realistic, and I do know that we can't change the world during these 2 days. But every time that we are together, every time we once again focused on this chronic pain problems, we will see a little bit of change. Here in Denmark, I can see that it's more often that we find something in the media about chronic pain. Our politicians are beginning to realize that up to 20% of the adult population do have chronic pain. It's a massive problem, and it doesn't disappear because you close your eyes. FAKS, the Association for Chronic Pain Patients, has been allowed to be host for the societal impact of pain here in Copenhagen, and I'm very, very grateful. But of course, our small association doesn't have the resources to get such a big event up and running. Therefore, I would like to thank EFIC, who has been responsible for the scientific framework. I would also like to thank Grünenthal, who is responsible for the funding and non-funding support. I would also like to thank, in advance, all those who have promised to support on our workshops and make presentations. And of course, thank you to the large number of pain advocacy and scientific organizations who want to share all their knowledge and experience. I will wish you all some good days. I know it will be hard, especially for all of you who are suffering from pain yourselves. But as I said, I'm very proud that you all want to help to make a difference. I hope everyone gets some good inspiration that they can use in their work, establishing better conditions for chronic pain patients. Thank you.
Thank you, Pia, for having given us food for thoughts for the following workshops and the discussions from the perspective of our chronic pain patients. And now, ladies and gentlemen, it is my pleasure to invite a representative of our very supportive partner, a representative of Grünenthal, to give his welcome to you. It is Alberto Grua. He is the Executive Vice President of Grünenthal Europe and Australia. And I may say he is also a friend of EFIC, giving us always some logistical and not only logistical support. Please, Alberto.
Well, thank you very much. Well, I will not talk about Australia today, because actually the real focus is Europe, and I'm very happy and proud today to be here. This is the third time I'm here. And I would say that it's inspiring us when we sit together considering the topic we have to address. And this is why, dear Mrs. Frederiksen, dear Mr. President Professor Kress, dear EFIC board members and councillors, dear Patient Alliance Europe board members, dear representative organizations endorsing the scientific aims of SIP 2012, and dear stakeholders from all over around the world, I'm so happy to be here, and I'm very sure that we will be starting soon in another important and very fruitful meeting. Also because, to my knowledge, it doesn't happen so frequently that there are so many people from so many different countries with so many different experiences and with passions sitting in the same room to talk about something so important. To have 400 or more than 400 experts, it's something not common. It's something that makes me feeling very proud, also because these are stakeholders representing different bodies, starting from the scientific association, as I said, patient groups, governmental bodies, healthcare institutions, very important. So I believe that the audience is the right one. The first two events took place in Brussels, when, let's say, we had also the privilege, actually, to be hosted at the European Parliament. Today and tomorrow we are in Copenhagen, well, because you know that this is also an occasion of the Danish presidency of the Council of the European Union, and this is something very important that actually I'm very proud of. When we consider what we will be doing, I believe that two things have to be highlighted. The first one is that, well, I was very impressed by the close cooperation between the Danish Association of the Pain Patients as well as the European Federation of IS chapters. Because, sitting together and, thinking about what to do and how to plan this event has been really very good. And I'm very happy that we will have another chance to facilitate the discussion about chronic pain and the impact that this has on our society. I do not have to be the one telling you that the economical and social burden of chronic severe pain is derived from inherent direct cost and indirect cost. And this is, to me, is really fundamental to always keep in our mind. A burden which our healthcare system have to tackle in spite of demographic change and increasing costs for technological advancements. Due to the high prevalence, pain and its significant impact on patient society, pain should be always recognized as a significant healthcare quality indicator. And this is why societal impact of pain is all about. A clear definition of healthcare indicators measuring pain in the population will be supportive in the implementation of a best practice approach to improve pain care in Europe. I believe, and I'm very convinced, that we have to keep this in our mind in these couple of days, because this is our goal. There are so many studies which have demonstrated that the prevalence of pain in the European population is very, very high. In fact, pain is the most common reason why patients seek medical attention. And as Professor Kress has said, we will be talking about this in all the workshops. These are the dominant themes that we have so far. Each SIP event has been fantastic and special. In my opinion, this one is even more. And one of the key amazing indicators that I can find is that this year more than 160 organizations have confirmed their official endorsement of the scientific aims of SIP 2012. Honestly, I didn't waste any second on statistics, but I can tell you this is not common, because this means that there is a conversion on the same topic coming from many, many different parties. And this is something that, while we will have our own discussions, we do not have to forget. I mean, in some ways, this gives us a even more stronger responsibility, considering that we represent so many patients. It strongly demonstrates, in fact, that the social impact of pain and illustrates the broad relevance of the topic of chronic pain as such a variety of stakeholder organizations. We have started this journey together 3 years ago, and once in a while, particularly when the topic is so relevant, it's really important to step back for a while and to see what we have been able to accomplish. And considering where we were and where we are, I'm very proud to say that, well, we did something already. First of all, EFIC and the Patient Alliance Europe and Grünenthal have engaged the discussion on the inclusion of chronic pain in health aging and chronic diseases. This was not granted 3 years ago. Second, the Parliament has adopted a resolution on non-communicable disease mentioning chronic pain. I believe this one has been an amazing result, considering that it has been possible to get that in a relatively short period of time. And more important, thinking about also the future, is that the roadmap for action has been designed and is today an instrument for validating and monitoring progresses. And this is why, actually, in the future, we really expect to have a significant rollout in the countries as well. I'm very sure that so far you didn't understand, or actually I was able to hide my Italian accent, so you all felt that I'm English. Usually it's an exercise that I do on purpose because, I could perfectly speak English, but I'm not. So, and actually this gives me also a special feeling when my excellent colleague Norbert van Rooij told me that we were able to get the high patronage of the Italian presidents of the Council of Ministers and the Italian healthcare minister, because, this is something important. This is something that gives a strong signal that here we're going to have a very, very important event. Of course, we never had to be happy. People who know me know that I'm never happy because I always want to do more. So this is why I feel, can we say that we are satisfied? I don't think so. We did a lot. We moved forward, and I'm very happy for that. But I really believe that it's now fundamental for us to ensure that we get what is more important than anything else. And this is delivering the common understanding that for sure at Grünenthal we are convinced that we need to work together on the improvement of pain management close to the patient. Therefore, I hope that this year's SIP will learn even more on how to implement the SIP roadmap at local level at the European member state. I want to highlight and underline this one because I believe that to make things happening, we have to roll out that in the countries, and this is where we will be focusing on, and we should be focused on in the near future. Last but not least, another proof that something is going to happen extremely special and unique is that when you all got your registration, I assume that you have seen all this book. And I know, you do not have to prove the quality of an event measuring the thickness of that. I know, this is not a wise rule. But, if you have the chance to flip through the pages, you will see that the content is even more amazing than the quantity. So, we are really going to have incredible discussions, and, I'm very happy that we will have the possibility to rely on each other to share ideas and to decide on how to move forward. So I really want to thank in advance all the presenters, on behalf, of course, of Grünenthal, for their efforts in preparing this year's presentation. I would like to thank you being present here today for contributing to the discussion with your expertise. And I look forward to lively debates on politics and science around the management of chronic pain. I wish you a wonderful, successful symposium with fruitful and constructive discussion and clear outcomes for improving the lives of pain patients in all Europe. And last but not least, I would like to thank my team because, I'm one of those lucky managers that doesn't have to work that hard because he's surrounded by people working harder than he does. And so this is another proof that you, my team, are excellent. So thank you very much, and enjoy the symposium, and let's be very productive. Thank you very, very much.
Ladies and gentlemen, you see, in line with the goals of this symposium, and also, I think, in accordance with the purpose of this meeting, this has been a very short opening ceremony, because we are not here for celebrating, we are here for working hard on the improvements of pain medicine across Europe and on the improvements of the situations of our chronic pain patients in our countries. So before we then continue in our workshop sessions, we will have a short coffee break, so you will have an opportunity to relax, to have some talks already with friends and with those who you don't know so far. But before I will see you then again in the workshops, I have to remind you, and that was a special task for me, I have to remind you of filling in the evaluation forms that are handed to you. And please do that, because it's important for us to have this feedback about what was good or what was maybe not so good during our 2-day symposium. Once again, thank you. Thank you for your contribution. Thank you also in advance for what you will tell us during the discussion periods of our workshops. And I look very much forward to the results of our 2-day meeting that hopefully will again fill such a thick booklet with new ideas and new concepts. Thank you so much.